there's going to be times where your patients go to the hospital for some reason. Depending on the length of stay in that hospital determines what we have to do. So if your patient goes to the hospital and that hospitalization is less than 24 hours, nothing needs to change. You can continue seeing the patient at your current frequency. You certainly want to document some sort of communication note on that. We'll have a video for you here in a bit about how to document that note. You can also notify the nurse as well, just to keep them informed. But in regards to changing frequencies or any other documentation, it's not necessary. So less than 24 hours, you can just proceed as usual. So usually that consists of an ER visit or maybe a observation only type short stay. Now, if the patient does go to the hospital for greater than 24 hours, we consider that a hospital admission, okay? So even if it's 25 hours, that's considered a hospital admission. So when the patient is admitted to the hospital, what's going to happen is when they get discharged, their nurse has to go out there and do a resumption of care visit, an ROC visit. You guys are already aware of a start of care visit, an SOC, which that's the visit that we need to be done by the nurse before we can see the patient for therapy. Well, the ROC visit functions the same way. So once the patient discharges from the hospital, the nurse has to do that resumption of care visit, that ROC visit, before we can see the patient again. So once you've confirmed that the nurse has done the ROC visit, what has to happen is you have to go out there and you do a post-hospital re-eval. And you set a new frequency, okay? So, and the same processes that go along with submitting your eval frequency apply here. So you're gonna do your post-hospital re-eval. You're gonna submit that frequency to our office. They're gonna submit it to the agency who gives the insurance, and that whole process goes through again. You can't see the patient again for a follow-up visit until you confirm that we have auth. So you certainly want to make our office aware of what's going on, because what happens is whenever a patient does go to the hospital, we mark it as hospitalized and we can help track that as well. What I always recommend is that you guys keep a running list of your own hospitalizations, and you can follow up every couple days or every week or so to check on their status. But it is important that you confirm that the nurse has done the resumption of care visit before you see the patient after they get discharged from the hospital.